All right. Well, we will get started. So, today, everyone, first of all, welcome to those of you that are joining live and to you that are watching the recording. Thank you so much for being here. Today is June 12th, 2025. And I want to give a big welcome to tonight's guest speaker, and I'll tell you more about her in just a minute. My name is Sid Notter, and I'll be the moderator for tonight's presentation. Before we get into tonight's pre-sale, let me give you some tips about what's coming up in the future. We have got, first of all, tonight is the second Thursday of the month. So tonight is the free community support group, which we have every month, always the second Thursday of the month. And this community support group is open to everyone, members and non-members. But then for members, we have on Monday, June 16th, Foods That Fight Pain. That's a support group hosted by Nicole Fogelman, which is really good. Tuesday, June 17th, Real Men Eat Plants. That's a fun group. And then Wednesday on June 18th, there's a new group premiering with Dr. James Thompson, and that is called Allergy, Asthma, and Immunity. And he spoke just a couple of nights ago, and it was fabulous. So if any of that concerns you, make sure you get in his support group on the 18th of June. So I am delighted now to tell you about our speaker tonight is Peggy Kraus. Let me tell you a little bit about her. She is a diabetes specialist and clinical exercise physiologist with a mission to help people erase the struggle of type 2 diabetes. Her clients say her superpower is reversing type 2 diabetes, and the results speak for themselves. Peggy has worked with thousands of people, guiding them to lower their blood sugar, lose weight, reduce medications, and reclaim their health. She refuses to settle for watching clients simply survive. Instead, she teaches them how to thrive. And I have seen this personally too. I've known Peggy for many years, and she's really great. Her signature program is called Erasing Diabetes, and it has transformed lives by proving that type 2 diabetes does not have to be permanent. Now she's taking that success beyond the doctor's office with her new virtual program, Diabetes Rescue. And we're going to be putting a link to that in the chat box. And she's bringing her plant powered approach to even more people anywhere in the world. Peggy also has created the 5 to Thrive program. That's a 6-week program that drives lasting health through 5 powerful lifestyle habits. And of course, it's all backed by science. Peggy's plant-based approach is extraordinary, and so are the results that her clients achieve. So if you have any questions for Peggy as she goes along tonight, type those in the chat and we will ask them as we go along. And if not, we'll get to those at the end. So welcome, Peggy. It is so great to see you.
Thank you, sis. Thank you for such a warm welcome. I have to say that you probably do that best out of all of our PBNSG co-hosts, co-facilitator, colleague hosts. So thank you. So thank you. Sis.
You are so welcome.
It's good to see you all here. I know a lot of your faces, and it's delightful to be here on this very warm day in New York, June 12th, right? I guess it's going to be the first day of summer soon, so it should be warm and it should be sunlight out till almost 9 o'clock here in New York. Anyway, I would like to share my screen. So if you were in my group on Tuesday, so I do the diabetes support group here for PBNSG, and we meet the second Tuesday of the month at 4 p.m. Eastern time. And so we covered some of this information then, but I didn't have time to cover it all. So I've sort of expanded on it. And I hope that you find it really interesting. So let me share my screen. Let's see.
Yeah, I think your title for tonight is the plant-powered approach to blood sugar bliss. Is that correct, Peggy?
That's right.
Awesome.
That's right. Let's see. Slideshow. My internet speed is not always the fastest.
Hi to Em. Hi to James. We see some new people have joined since we opened up. Good to see you guys tonight.
There we are. Okay, you can all see that now, right?
Well, we're seeing everything with your slides up. There we go.
Okay, terrific. So yeah, Diabetes Rescue, the plant-powered approach to blood sugar bliss. And you all know what the moral of the story is. You all know what the solution is. But I thought that I would take you through. Let's go back to the beginning. Let's go back to the beginning. Let's start at square one. And I'm going to cover this part quickly because I think that most of you know this. But it's so important to back up and get a good grasp of why diabetes is so important to reverse. So in clinic, we don't say that we can reverse diabetes, type 2 diabetes. First of all, we have to clarify that it is type 2 diabetes that we are dealing with, or pre-diabetes. But to leave it open as just diabetes is not really good practice. So type 2 diabetes, we don't really say in clinic that we can reverse it. We say that we can put it in remission, sort of like cancer. We put cancer in remission. We put type 2 diabetes in remission. And I don't really like that terminology. I like reversing type 2 diabetes because for several reasons, but I think that I think we almost all of us have the potential to develop type 2 diabetes. We're going to talk a little bit tonight about why. So if you put all of those negative habits into play, you're going to develop type 2 diabetes. If you pull them all back and you do the right thing, you've reversed it. So yeah, I'm not happy with the remission, but if I say remission, reverse, I do mean the same thing. So let's talk about the numbers of diabetes, and you all know this. So not my favorite, because to have normal glycemia, we call it, and to have not diabetes is if your A1C is less than 5.7. Prediabetes is 5.7 to 6.4, and full-blown diabetes is what we call it in clinic, is equal to or greater than 6.5%. And hemoglobin A1C, of course, is the average of your blood glucose over 2 or 3 months' time, because that's how long the red blood cells live, right? And the A1C measures the stickiness, how much sugar is coating those red blood cells. But I don't like this chart because it seems that if you have a blood sugar of 5.6, that's normal and it's fine. I'm sorry, if you have an A1C of 5.6, that's normal and it's fine. Well, compared to an A1C of 4.4, it's not, right? And I'll go on to tell you a little bit more about that. But what I want to preface tonight with is that I want you to think about this. When your blood sugar is high, you got to think about those glucose molecules as shards of glass that are running through your bloodstream, and they're tearing up the innermost lining of the blood vessel wall. So that's the endothelium. The endothelium is incredibly fragile, and it's incredibly important to your health for many reasons. But if you have shards of glass, if you just have a few shards of glass, well, that's one thing. But if you have many shards of glass, if your A1C is 14%, you've got a problem, right? Because you are tearing up maybe the most important piece of your body. Okay. Wait. Where am I? Okay. So I talked about this on Tuesday, the challenge of prediabetes. Now, these numbers are staggering. 98 million adults in the US have prediabetes. That's 1 in 3 adults. 80% don't know they have it, and 70% of those people are projected to develop type 2 diabetes. That's incredible. Let's move to type 2 diabetes. I'm sorry, let's just move to diabetes. So these numbers are not separated for type 1 diabetes and type 2 diabetes, but we know that only about 5% of the people with diabetes have type 1 or the other diabetes. And we won't go into that tonight. So the majority have type 2 diabetes. So 38 million adults have diabetes. Most of them, of course, are type 2 diabetes. That's 1 in 7. And 1 in 3 seniors have diabetes, right? So we went from pre-diabetes. Now, the 70% who had pre-diabetes, they've got full-blown diabetes. 23% don't know they have it, right? So what's going on in the background? They don't know they have all these shards of glass that are tearing up the fragile blood vessels in the eyes, in the bottom of the feet, in the kidneys. All these things are creating disaster, right? So even mildly high blood sugar can harm your body, complications without knowing it, blindness, kidney failure, amputations. Not a pretty picture, folks. So there is just this epidemic, right, of diabetes in our country. We'll talk about a little bit what's driving it, but first let's talk about how are we treating diabetes? Like, you know, you'd think that the American Diabetes Association would have this figured out by now, right? So we have medications coming out of the yin yang to just help the numbers look better, but they don't remove the cause of diabetes, right? What low carb diets are supposed to fix the diabetes? Well, they don't really. They just mask the numbers and they actually can make insulin resistance worse. We're going to go into that in detail. You know, and then people with diabetes are told, well, just eat every 2 to 3 hours. That'll keep your blood sugar from spiking. First of all, that's not true. That eating so often actually raises blood sugar. So we've got all this advice that is bad, right? This bad advice. If it was good advice, we'd see the numbers coming down. Going up all the time, going up all the time. So that's how I can safely say and confidently say it's bad advice. So what is insulin resistance? Insulin resistance, because I mentioned this in this prior slide, I want to make sure that we're all on the same page. Insulin resistance is when your cells don't know how to use insulin. So I'm going to back up for a minute. Okay. What causes? What is insulin resistance? I can explain that best by giving you a scenario. Okay. Say you're eating the American diet, right? You got eggs and you have cheese and you have beef and all kinds of meat, whatever, oils. There comes a time, and everybody's different, but there comes a time where the body says, I can't put any more of this fat in the stores where it belongs. So the body naturally stores dietary fat, right? The fat in our food in adipose tissue. And adipose tissue is around your belly, it's on your behind, it's on your legs. But as a defense mechanism, as a survival mechanism, your body all of a sudden says, whoa, I can't store any more of your fat in my adipose tissue. You got to put it somewhere else. So the body does. And that fat is stored in the muscle cells, in the liver, in the kidneys, in the brain, in the artery walls, and lots of other places, right? But those are the main ones. when your body stores the fat in the muscle cells, that develops type 2 diabetes. So type 2 diabetes, by definition, is too much fat in the muscle cells. When your body stores fat in the artery walls, that by definition is arteriosclerosis or atherosclerosis. When your body stores it in the brain, that's dementia. We call dementia type 3 diabetes now. A big one on the rise is fatty liver disease, that when your body takes that extra fat and puts it in your liver, that mucks up everything in the liver, and that develops as fatty liver. Then it goes on to be cirrhosis, and then it could eventually necrosis and cancer, liver cancer. So the American diet is setting you up for all of those catastrophic conditions: type 2 diabetes, dementia, heart disease, kidney disease, liver, etc. I think you get the point. Here's another illustration. Okay. On my left, this no insulin resistance, right? This is somebody who has a normal blood sugar level, normal A1C. The red area is, of course, the bloodstream. And you'll see in the bloodstream there are some glucose molecules, the blue, and some green molecules, the eyes. So glucose and insulin, they're in there, they're in the bloodstream, but there's not a lot of them. There's just enough, because remember that your brain and your spinal cord need glucose and can only function really well on glucose. And this purple line here, this is the muscle cell wall. Where's my pointer? Here it is. I don't know if you can see my pointer, but there's little gaps here. Gaps, right? Those little receptors, we call them, or little doorways, they let the glucose into the muscle. And then you can see that in this normal muscle cell, that there are lots of glucose molecules. And those glucose molecules make lots of energy. Those little red E circles are energy, because the mitochondria is the part of the cell where energy is made. So it flows very nicely. There's some glucose and insulin in the bloodstream. It flows into the muscle cell. And then from there, energy can be made and power your body to do whatever it is that you want to do. You are fierce and you are fueled. You'll notice that in this no insulin resistance side, this normal side, there are these yellow globules. That's fat. No, there really shouldn't be fat in the muscle cell, but there's a little fat in here, but still everything's working well. On my right side, this insulin resistance frame, see where there's lots of glucose and lots of insulin, right? That's because they're not flowing into the muscle cell. One of the reasons why is because notice over here on the normal side, there are 3 receptors. And on the left side, there's only 2 receptors. That's because the longer you have high blood sugar, those receptors become less, they don't work as well, right? They become receptive to insulin. And the reason why all these glucose and insulin molecules are backed up in the bloodstream is because there's too much fat in the muscle cell. Just think about like going to the movie theater, right? You arrive in your cab, let's say, or car, and you try to get into the movie theater, but you can't. Why? Because all the tickets have been sold and every seat has been taken. So what do? You have to wait in the street or under the awning of the movie theater, and you have to wait until somebody comes out. Well, same thing with type 2 diabetes. In order for those glucose molecules to flow in, you've got to wait until some of those fat molecules have moved out of the muscle cell and the body's just sort of gotten rid of them. But in this frame, so there's a lot more fat globules in the muscle cell. So there are fewer glucose molecules in the muscle cell, and there's less energy. That is why when your blood sugar is 180 or 250 or 300 or 420, you feel like walking across the room is the hardest thing you've ever done, right? Because that glucose is not getting into the mitochondria to make energy. Any questions so far? I hope that was clear for everybody.
I don't see any in the chat, but I do have one.
Yeah.
Oh, I like that how you said diabetes is a natural reaction, right? It's actually a defense system that our body has employed to deal with all the fat that we're putting into our bodies. And then doesn't type 2 diabetes increase the risk of other diseases, right, Peggy? If you have type 2 diabetes, you're at a bigger risk for heart disease and other things.
So that's sort of like a double-edged sword. Having type 2 diabetes means, having type 2 diabetes means that you probably have some extent of most of these. If you have type 2 diabetes, you probably have some degree of coronary artery disease just because we're dealing with the same insulin resistance problem. You probably have some form of overweight or obesity. Your cholesterol is high. You have fatty liver. Dementia, neuropathy. So it all stems from insulin resistance. And your DNA, your genetics will likely point you to the insulin resistance problem that is prevalent in your family. So if you're type 2 diabetes, we often do you have a family of type 2 diabetes? We often ask. That is because, and well, two reasons actually, but that is because uh, the children develop the diseases of the parents to a degree because there is that genetic component towards, say, type 2 diabetes or towards heart disease. But also we know that recipes and customs and traditions travel in families, so that if your mom has a recipe book full of the American diet recipes and passes them down to the daughter who's going to feed the husband and the kids, so that recipes travel in families as well. But on the other hand, the other token, so to answer the other half of your question, you're right, because type 2 diabetes increases the risk for heart disease because it shrinks the size of the cholesterol molecules. So the cholesterol molecules that are they're more easily pass through the blood vessel walls and are more likely to become plaque. So that, and there's inflammation, and but yeah, same thing with blindness, neuropathy, erectile dysfunction. I mean, there are so many things that are related to diabetes, sleep apnea. Yeah, like the list goes on, because it's those shards of glass that are flowing through your system. They're just mucking up everything. Did I answer your question, Sid?
Yes, thank you.
You're welcome. All right. So let's turn the corner, right? I call them the 3 F's of diabetes remission. Reversing diabetes, erasing diabetes, whatever you want to call it. Fiber, fat, and function. Okay. So fiber, we know, acts like a scrub brush. I mean, whether it's soluble fiber, and soluble fiber acts like a sponge and kind of sucks up toxins and fats and hormones that are not needed by the body, escorts them out. Fiber also, the the insoluble fiber acts like is coarse and sort of like Brillo through the bloodstream, and it sort of cleans away, and also through the intestines, cleans out the little pockets of that have formed in the intestines. So fiber is helpful. Fiber also, cholesterol molecules, and doesn't really happen with glucose molecules, but cholesterol molecules latch on to the fiber, again, escort it out. So fiber is helpful. Fat, not helpful, right? It's one of the 3 F's, but it's because we got to talk about it. So fat in the diet is a problem, right? We need some fat in our diet, but we don't need a lot of fat. We don't need gobs and gobs of olive oil. It's not it's, we talk about healthy fats. I don't like that term because it almost says that you're allowed to have more. Oh, it's healthy, I'm allowed to have more. While fat found in food can be considered healthy. Let me step back. While fat found in plant foods can be considered healthy, we don't need a lot of it. So the term healthy fats sort of like gives a little bit of a license to have more. And while it's good, like nuts are great because they have fiber, uh, they have polyunsaturated, monounsaturated fats. They have compounds that keep the heart beating on a regular rhythm. Yeah, they're good, but we don't want to have lots of them, right? Dr. Hannah Kaliova from Physicians Committee for Responsible Medicine has done much research on this, that the optimal amount of fat for a human is between 20 to 30 grams per day. That's it. That's not a lot of fat. So if you're going to start eating animal products, which eggs, any kind of meats, is going to way drive you over the edge. Even too many nuts, or if you want to, as some plant-based eaters don't shy away from oils, and that's a preference. But that's a problem. Once you start adding oil to your diet, that's a lot of fat. So fat is the second F for diabetes remission. And the last one is function. So moving around, function. How are you going to function today? Are you going to exercise? Are you going to walk to the mailbox? Are you going to make your bed? Are you going to are you exercising? You're going to ride your bicycle? What is it going to be? So exercise works a little differently than fiber for lowering blood sugar, but it's important. And even though it's a different mechanism, it works. So the more movement that you do, especially when your blood sugar is high, that's a natural way that you can bring it down, right? Just move. Okay. So what causes diabetes? The fat you eat, the fat you wear, and chemicals. So the fat you eat, I think we talked enough about. The fat you wear is a problem too, because I mean, we've seen that most people who have type 2 diabetes are overweight. And that is because they have too much fat in their muscle cells, and other stores of fat has made them overweight and obese. And we've all heard stories where people have lost the weight and the blood sugar has either improved or has resumed normal levels. So the inflammation piece, the fat in the muscle cells, that's a problem, the fat you wear. Now, chemicals is something that, again, acts a little differently, but chemicals in food, say the chemicals in Cheerios or in Wonder Bread, that's a problem. for diabetes. The chemicals in fish is a problem for diabetes. The newest scare, or the newest realization for chemicals, is microplastics, and how microplastics are everywhere. But particularly, I mean, think of the foods we eat. Fish, right? What fish swim in polluted waters, and they consume the microplastics in the water, in the fish that they eat, and there was a study about a month ago now, that the average American adult, has the equivalent of one plastic fork of microplastics in their brain. That is incredible if you think about it. Like, we've lived this microplastic world so long that could actually be the case so far. So, I mean, it's a topic for another story, for another day, I should say. But please don't microwave in plastic. Don't cover your food with Saran wrap. The black plastic forks that we so commonly pick up with our salads, or whatever, spoons with our oatmeal, those are mostly made of the plastic that's recycled from electronics. And those plastics have been sprayed, or they've been treated with flame retardants, right? So when you take a spoon and you dip it into your black plastic spoon, and you dip it into your hot lentil soup, there's a good chance that you're getting some microplastics that have been treated with flame retardants. So please be careful, limit your exposure. We can't eliminate it, but we can be smart about it. So. And of course, what fixes the cause of diabetes? So of course, I didn't put it on here, but let's limit our fat intake, right? Because that will limit how much fat molecules are in our muscle cells, and that will lower our blood sugar, but also the fiber and the exercise. Okay. Yeah. So I have been an exercise physiologist in cardiac rehab almost 30 years. And when I was a young whippersnapper, I heard one of the nurses say to somebody who was finishing up his exercise program for the day, she said, "Oh, and just watch that blood sugar, because it's going to keep falling throughout the day because you exercised." And that, like, it just stuck with me. Like, if exercise could do that, like, what else could do that? What else could lower? Well, wouldn't you know it? Here it is, 30 years later, I've put it all into a system. So my signature course was Erasing Diabetes. I taught that to insurance paid patients in a doctor's office. But not being in the doctor's office, I had to digitalize it. I had to put it into a remote format, and I called it Diabetes Rescue. So I use the framework that I use is called the Rescue Me Matrix. It is seven bullets for lowering blood sugar. Some of them we talked about tonight. Some of them you would never guess. I've created a discussion room, because we know group support is incredibly important to success when it comes to lifestyle change. Think about Jean Nidetch. If any of you who know who she is, she was the entrepreneur who started Weight Watchers with 6 women in her living room. And she was focused on just talking about what was happening, right? Maybe educating a little bit, like this is what I did, and this is what I know about so and so. Um, and the support of the group. So people saying, "Oh yeah, I've done that," or "Why don't you try this?" Like not all the answers come from me. The answers come as a group, and they come out of other people who have lived this um, lifestyle. So the official launch for the course is next week, but I'm going to give you an insight if you want to go into peggykraus.com rescue me, you'll be able to see the more about the course and register for that. And I believe that that is it. So I'm going to stop sharing, and I am happy to take any questions, comments.
I'm curious. You said that the course has 7 bullets, and some of them we'd never guess. And I'm curious to know what is one
Oh,
that we would not have guessed.
oh, how about vinegar? Vinegar has been shown to lower blood sugar. It's also shown to help with weight loss. But the acetic acid in vinegar is promotes low blood sugar. So if you take 2 tablespoons of vinegar in an 8-ounce glass of water, or if you really have a hard time, 1 to 2, you could probably cut it down to 1 tablespoon in an 8-ounce glass of water, you'll have lower blood sugar the next day. So if you abhor the idea of drinking vinegar, watered down vinegar, you can put it on salad, you can put it in recipes for, say like a lentil recipe or whatnot. But yeah, vinegar is one of those things.
Interesting. Now, just today, I bought some seltzer water at Walmart and I put my peach vinegar in it with ice. You would not believe how good it is with these fruit flavored vinegars in seltzer water. It's very refreshing. It's kind of sweet. I don't know why it tastes sweet because the vinegar actually has no sugar, but that might be a good way. Does it have to be plain vinegar or can it be flavored vinegar? Any vinegar?
Yeah, any vinegar because it's not the kind of vinegar, it's the acetic acid, which is that active sour, tangy, or tart, I should say, tart flavor of
Mhm.
vinegar. So
Cool. So, how about with the microplastics? You were talking about the black fork and the hot food. Would it be as concerning if you were eating cold food with the fork? Would we still need to be as concerned about the plastics?
not as concerned. I don't really know the um how many, say, parts per million
Mhm.
enter the food, and then how many are stored in the body, eliminated from the body. I'm not sure of those numbers, but hot food, of course, um, breaks down the structure of the plastic more so.
Mhm.
I would imagine things like oil or vinegar or something that's either very fatty or very acidic is going to do similar to a hot beverage. Um,
Mhm.
yeah, we're learning.
Yeah, the more I read about microplastics, I'm switching over to glass containers. I'm making some changes based on what I'm reading. What about children? I've read that type 2 diabetes is becoming more and more prevalent in children as young as 10 and younger. Is that true, Peggy?
Yeah, because
Yeah,
they're either eating the diets of their parents who probably
yeah,
also have type 2 diabetes,
yeah.
and exercise is limited in schools and in unsafe neighborhoods so that they're not as active, and fast food, and yeah, it absolutely is true. Um, I mean, you've all heard the statistic that this generation of kids will not outlive their parents. It's likely that they're not going to outlive their
Mhm,
parents, and that is just a scary thought. Um,
mhm.
yeah. I was trying to remember a statistic. There was a study about kids with type 2 diabetes, and I'm sorry, I just can't remember it. Trying. It's not coming to my mind.
Yeah, no problem. I know parents don't intentionally want to hurt their children, right? No parent would intentionally want to do that, yet there's so much ignorance about food. It can be so frustrating to watch sometimes.
Yeah, it is, and even in, I don't think it's limited like we think that it might be limited to lower income families, and we do see a lot of it there. But even I see it in cardiac rehab. I mean, I work in Southampton, which is a high, it's an affluent neighborhood, and I come up with it, come up against it the whole time. I really have to be careful about how I talk about plant-based diet in the hospital. The registered nurse, she's not digging me. But even when I say, like, I ask people patients to keep food logs, and then I review them with them, and I highlight all the good things that they're doing. But I can think of this one woman. She was having chicken 5 nights a week, not a bean on her menu. Scant fruits and vegetables. Like, have you thought about like maybe having a meatless Monday or something? And she was, chicken, like, it's not a vegetable. Like, it's okay to have sometimes if you really, but let's put some other. She was like, chicken. Oh, chicken's great. So it's not a just yeah, it's not, it's even in the affluent communities. It's just that this is what we've been fed in the media, and that yeah, some people are just not willing to change their thoughts.
Yeah. You know what one of my biggest pet peeves is to watch the Arby's beef commercial and then watch the musical commercial for diabetes drugs, right? Have you noticed how the commercials are kind of like musicals now? Everybody's dancing and singing about a diabetes drug.
That
So
is
I
true.
digress, but yeah, that's nobody's connecting those two dots very well, are they?
No. Oh my goodness.
So Peggy, when is your support group on PBNSG, your diabetes support group? When does that meet?
And we meet on the second Tuesday of the month at
Okay.
4 in the afternoon Eastern time.
4 Eastern. Okay.
Yeah, and I think next month we my friend um Peter Friedfeld, who Peter was my first diabetes patient, walked to my office, said he was diagnosed with type 2 diabetes, and I said, something's not right. He just didn't look it to me. Anyway, I thought that he had something called LADA, latent autoimmune diabetes in adults, which is a type 1 diabetes, but a very slow developing type 1 diabetes. And Peter went on um, to be diagnosed with type 1 diabetes because we didn't catch it early enough that it became full blown type 1 diabetes. Anyway, so he's going to be my guest, I hope, for July, and that will be July 8th, 4 in the afternoon. And his story is remarkable, and he has now developed this um it's called Diabetes Sangha. It's meditation for people with diabetes. Because diabetes stress is real. I mean, if you think about, you have to think about, what am I going to eat? Medications, if you take insulin, sleep, and there's so many things to think about if you have diabetes. So stressful. It can be so stressful. Or plant-based diet can really help to eliminate the cause, bring your blood sugars down, and even if you can't reverse it totally, because type 2 diabetes, if you've had it for 40 years, um, it's not as easy to reverse, but it can be done.
Okay.
So, but I love to get people who have just been diagnosed, like, stick with me. We can do this.
Okay, there's a question here from James. Do you run into patients considering GLP-1 agonists, and how do you advise them if if they are already on the drug?
Yeah. Ugh. At first I w I almost didn't want to take on students who were on the medications and then they just got to be so worldwide. And so I teach them plant-based diet, lifestyle habits, because eventually they're either going to stop taking it because it costs too much, because they feel horrible on it, or I said that they can't afford it. Yeah. So when they when that happens, they need to have a fallback. So if they're eating a plant-powered diet and they're moving and they're sleeping well and they've got their stress in check, like everything's going to fall in place because we know that fiber increases GLP-1 just like those drugs do. So um, I do encourage lifestyle change, and I just wait for the chips to fall and then see them through that.
Okay. Mike has a question.
I was going to say, you probably know this, but Dr. Michael Greger just self-published a book about GLP-1s. Ozempic. He's giving interviews on the internet, and he says other things that people may not realize is that the weight loss only continues for the first year and then it plateaus. And when they stop taking the medication, it goes back up again. My fasting blood sugar has always been a little bit high, but my doctor checked my A1C for my last checkup. It was 5.8. So I'm working at losing this weight, but I'm wondering what we consider to be an average healthy A1C.
Nice, nice. Yep. The weight loss and blood sugar lowering do usually happen together, but yeah, I've seen them happen individually. So just keep at it because one will follow the other. Good for you.
Is there a target goal, I think, that to reach with that A1C number, or
Yeah, so my first patient, Peter, his A1C 4.4, the lowest his doctor had ever seen. So that's the lowest that I know of. I would say go there because if you can minimize the number of shards of glass in your bloodstream, do it.
My plan is
But
to go as low as I can go, so we'll see what happens next.
that's it. One blood test at a time. And remember that A1C has a standard error of 0.5%. So if you get your A1C result and it's 6.0, it could really be 5.5 or it could be 6.5. So you could have no diabetes or have full-blown diabetes or somewhere in between. And we just don't know because that's the best we have right now. So if it goes up a little bit, if it goes down a little bit, take it in stride. In 3 months, check again and look for the trends. Don't get fixed on those little increases or decreases. Just look for the trends. So, Mike, I love it that you're looking forward to your next measurement.
okay, follow up here from James. Do you advise CGM monitoring for pre-diabetics?
Love it. So,
What's the C? I can guess the GM, glucose monitoring. What's the C?
continuous.
Oh, okay.
So here is the Stello. So let me back up. So yes, continuous glucose monitoring, excellent, because it gives you either every minute, every 5 minutes, or every 10 minutes, it gives you the current reading. So it's a little sensor that you wear on the back of your arm. You can wear, some of the CGMs are approved to wear on your stomach, on your midsection. But it transmits to an app on your phone. And every minute, 5 minutes or 10 minutes, depending on which version you have, it gives you a current readout. So for years, I would say, I don't know how old CGM technology is, but I'm going to say it's 7 or 8 years old. I mean, that's how long it's been on the market. And at first, they were really rough and not very telling of the blood sugar. Just gave you the number. Now there are alarms and arrows that show, is the number rising quickly? Is it sort of rising? Is it steady? Is it going down? So this way, if you have, say, if you have type 1 diabetes and you're reliant on insulin, your blood sugar is falling, you can act quickly and you can head that off. But now the question was about prediabetes, and I think it's a great idea to know what it is about your lifestyle that's raising the blood sugar numbers. The reason why I bring this, the Stello, is because now we have over-the-counter CGMs. It used to be that you had to have prescription from your Medicare, you had to have approval, or you had the prescription from your doctor, approval from your insurance company, and you had to have a minimum number of times that you took blood sugar readings with finger stick, you had to take insulin. So the rules keep changing because insurance companies see how valuable CGM is. But now that it's available over the counter, you don't need a doctor's prescriptions, you don't need to be able to certain medications. You just so the Stello, the one that I have here, is it works for 15 days. Then you need to replace it with another one, or not replace it with another one, but it works for 15 days. And 2 units cost $99. If you can go to Stello, STELO.com, or you can get it on Amazon, same price. If you do a subscription, you can get it for $89 for the two sensors. So yes, good question, James. And the more you know about what drives, I mean, Diabetes Rescue is full of, this is what works for most people. But if you know what is unique to you, and you can know that with a CGM, it's more information for you, and that's just the better off it is for you.
Is there any data on how accurate the CGMs are, Peggy?
So I'm not aware of actual data for CGMs, but I know that they mimic the glucometers that we do finger sticks with. Finger stick measures capillary blood sugar, and CGM measures interstitial fluid. So the more accurate is the finger stick, because you're measuring the actual glucose in the blood, but the CGM is measuring what glucose is in the fluid under the skin, which runs behind a finger stick about 15 minutes or so. So CGM is accurate, it's just delayed. So if you feel lousy, if your head is spinning, you have a headache, you're not seeing straight, and you think you might have low blood sugar, if you can get a finger stick and get an accurate number, you'll know how to treat that best. Rather than a CGM is going to be behind 15 minutes. So you'll know with the arrows on the CGM sort of where it's headed, but you don't really know the exact numbers. But still, the CGM and the interstitial fluid is an excellent tool for intervening for blood sugar.
Wow, that's good to know. I wasn't aware of any of that. Thank you.
You're welcome. Yeah. Diabetes is the progress and the dissemination of the information is so good. It's just that they're not getting it all right.
Yeah.
with this stuff, like the data and the electronics and the information technology is the word that I was looking for. Incredible, incredible. And this thing is going to be obsolete in a year or two.
Well, when I was on a cruise in March with some friends, one lady said, "Oh, my husband's blood sugar is da da da." I go, "How do you know that?" It was on her app. I'm like, we're in the middle of the ocean and you know what your husband's blood sugar is? I've been living under a rock, apparently.
Yeah. Well, don't worry about it, Sid. Um, yeah.
But my grandma was blind from diabetes. My dad took shots all the time for his diabetes. So it's in our family, but of course, it doesn't have to strike me because I'm not following their footsteps with lifestyle. So Emily says, "Thanks so much. This was wonderful. I have to get to another commitment." So thank you, Peggy. Before we sign off, I don't see any other questions. There'll be a replay of this posted shortly on the PBNSG replay section. So be sure you watch that again. Maybe send your friends, because tonight's was a community support group, right? Free to everybody. But if you become a member, it's only $10 a month to be in all the support groups, including Peggy's fabulous support group on diabetes. Well worth it. So as we sign off, Peggy, do you have any parting words of wisdom for us?
Yeah, I'll give you my number one tip for lowering blood sugar is watch the fat in your diet. Really watch it. I keep it
And that's
low.
any kind of fat, right? Not just saturated fat, even the unsaturated fats.
Yeah, I mean, the research points the finger at saturated fat, but I've seen that, that even the unsaturated fats, when you have too much of it, is going to be a problem for diabetes. Whether it's
Yeah.
avocados or oil or nuts, it's we only need what we need. Everything else is just too much. The body can't handle it.
Right.
So.
Well, thank you so much, Peggy. Thank you, all of you that were able to attend live and that are watching the replay as well. This was fabulous, Peggy. I learned so much. Thank you so much again.
Thank you, Sid, and thank you for being with me tonight, and thank you everybody for being here.
Thanks for watching and for being a part of the PBNSG community. If you found this video helpful, be sure to give it a thumbs up and subscribe to our channel for even more plant-based insights, expert interviews, and delicious recipes.